If you've been struggling to conceive, the world of fertility treatments can feel overwhelming. One option gaining popularity is intrauterine insemination, or IUI. This procedure involves placing sperm directly inside the uterus to increase the chances of fertilization. Today, we're going to dive into the details of IUI and explore your journey towards parenthood.
Intrauterine insemination, or IUI, is a fertility treatment that bypasses certain obstacles to conception. During IUI, a doctor introduces specially prepared wash sperm directly into the uterus via a thin catheter. This helps the sperm get closer to the egg, increasing the chances of fertilization.
So, why choose IUI? Here are some common reasons. Male factor infertility. If your partner has a low sperm count or decreased sperm mobility. Cervical issues. If the woman's cervical mucus might be hindering sperm movement. Unexplained infertility, when no specific cause for infertility can be found. Same-sex couples or single women. IUI with donor sperm opens up a path to parenthood.
Don't worry, the IUI procedure itself is relatively quick and painless. Think similar to a regular gynecological exam. Here's how it goes. Preparing the sperm. Your partner's sperm or donor sperm will be washed in a lab. This concentrates the healthiest sperm into a smaller volume, monitoring ovulation. You may receive medication to stimulate ovulation, and your doctor will monitor you to determine the ideal time for the procedure. The procedure. Using a speculum, your doctor will insert a thin, flexible catheter through your cervix and inject the sperm into the uterus. Rest. You'll likely rest for a short time before heading home.
After your IUI, there are a few things to keep in mind. Spotting. Mild spotting is possible, but if you experience heavy bleeding or pain, contact your doctor. Taking it easy. Your doctor may recommend light activities or modifications for a day or two. Managing expectations. While it's exciting, try to maintain a sense of calm and focus on self-care during the waiting period.
The period after the IUI is often referred to as the 2-week wait, and it can feel like an emotional roller coaster. It's essential to be patient, as it takes time for the pregnancy hormone to build up in your system. Most doctors recommend waiting at least 14 days before taking a pregnancy test.
Though tempting testing too early can lead to a false negative. However, some women may see a faint positive as early as 9 days after IUI. If you have had a trigger shot of CG to induce ovulation, wait even longer, as it can interfere with the accuracy of a test.
Let's break down what might happen in your body after IUI, day by day. 1 to 3. Possible light spotting due to the procedure. This is usually nothing to worry about. Day 6. The earliest potential time for implantation. Keep an eye out for signs like light spotting, cramps, or breast tenderness. Days 7, 11. Implantation may continue, but many women won't experience noticeable symptoms yet. Day 14 and beyond, the recommended time to take your pregnancy test. If a trigger shot was used, make sure the Hg from the injection has cleared your system before testing.
Seeing a negative pregnancy test can be heart-wrenching, and that's perfectly valid. Allow yourself time to process your emotions. Here's what you need to keep in mind. Timing matters. If you tested before the 14-day mark, a false negative is possible. Retest in a few days or consult with your doctor to be sure. Success rates. While IUI can be successful, it doesn't always work on the first attempt. Talk to your doctor about next steps and potential adjustments to the treatment plan. Support is key. Reach out to loved ones, a therapist, or online support groups. You're not alone in this journey.
While there's no guarantee, some factors can optimize your chances of success with IUI. Sperm health. Encourage your partner to maintain a healthy lifestyle, as this can improve sperm quality. Some doctors recommend avoiding ejaculation for 3-4 days before the procedure. Healthy habits. Prioritize good nutrition, exercise, and stress management for both partners. Avoid smoking, excessive alcohol, and any medications that could impact fertility, hormonal support. Often, fertility drugs are used alongside IUI to boost egg production and time the procedure perfectly. Open communication. Maintain open and honest communication with your doctor throughout the process.
If multiple rounds of IUI are unsuccessful, don't lose hope. Your doctor might suggest exploring other fertility treatments such as in vitro fertilization, if a more complex procedure where eggs are fertilized outside the body and then transferred to the uterus. Other assisted reproductive technologies. There are a variety of options, so discuss the best choices for your individual needs with your doctor.
The path to parenthood can be filled with twists and turns, but remember, you are not alone. IUI is a powerful tool, and with patience, understanding, and the right support, your dreams of having a family can become a reality. If you or someone you know is navigating fertility challenges, there are resources available. Leave a comment below, and don't hesitate to reach out to trusted support groups or your healthcare provider. Subscribe button, links to relevant support resources, and suggested videos on related topics.